afternoon. I'm standing here with Mayor Turner, of course, Dr. Persh from the City of Houston, Barbie Robinson, our Public Health Director for Harris County, and Mark Sloan, our Emergency Management Coordinator. Mayor Turner, first of all, thank you for joining us this morning. And I want to recognize all the folks standing here for their incredible commitment throughout this pandemic. Today we find ourselves in a difficult situation. We find ourselves retracing our steps toward the edge of a cliff. It is very conceivable that we could once again be heading toward a public health catastrophe. Once again, our healthcare system is strained by COVID-19. It's straining our staff, it's straining our hospitals, and it's imposing heartbreak and anxiety on so many families in Harris County. Just moments ago, I got off the phone with leaders at the Texas Medical Center and Harris Health, and what they're explaining to me is we're facing a perfect storm. A strained nursing and hospital staff, a more transmissible variant, and limited ability to implement public health interventions at the local level. They're also telling me, these leaders in our hospital systems, that this is no longer a disease of the old. The average age of the patient being admitted into Texas Medical Center hospitals is 20 years younger than it was before. We're now having patients on average in their 40s, which means there's people in their 30s and their 20s. The number of patients are the increase started March. They're rushing up. It almost looks like a vertical line. We have to shift that curve again and change those trends. Our Harris Health public hospital system is now facing an internal emergency situation. Our emergency rooms are overwhelmed at both Ben Taub and LBJ hospitals. We have more need for hospital beds than we have staff and beds for the patients. In response, I've ordered the county to raise our COVID-19 threat level from orange to red. Here's what that means. This level signifies severe and uncontrolled spread of COVID-19 in Harris County. That means outbreaks are present and worsening, and our public health capacity is strained or exceeded. Now, last time we shifted to red was in June 2020. Our community rallied, and within 14 days, the numbers were trending down instead of up. So we know we can change this. And what I'm asking you, all of you, is to help us change this trajectory once again. We're going to need everybody to do their part. What we need to do is logical, and it's quite obvious. Everyone needs to get the vaccine. And if you're not vaccinated, obviously everyone who's eligible, and if you don't have the vaccine, You need to avoid all but the most essential interactions. It's the only way out of this. Unvaccinated and vaccinated individuals need to wear their masks. Whether vaccinated or unvaccinated, and this is crucial, do not use our area emergency rooms for routine medical care. Use emergency rooms only for truly life-threatening emergencies. I'm hearing this from both the leaders of our public hospitals as well as our private hospitals. We desperately need to allow space in our emergency rooms. There are virtual care options available. There are clinics available for medical needs that are not life-threatening. The most important piece of all of this that can really make a difference is for people to get the vaccine. Nearly 2 out of 3 people of the eligible population in Harris County have had at least 1 shot. If you're in the minority that has not gotten the shot, you're the reason we're here today. I understand initially some people had questions about the vaccine. I get that. But the evidence right now is very clear. It's safe and it saves lives. If you haven't been vaccinated, your window to protect yourselves and your window to protect others is closing. There's a limited window, and the reason is that the longer the virus spreads among the unvaccinated population, the greater the risk we all face that variants will evolve and will evade our vaccines. If you're putting off being vaccinated, you are not only gambling with your health and your life, but you're doing that with the health of the rest of the community, including those who have gotten the vaccine. Now, everyone is doing their part. All the folks here are working incredibly hard. Health professionals have been going for 18 months. And I do want to take a moment and thank our health professionals. Part of the reason for the strain is so many of them are burning out, but yet so many of them are continuing. And so to you, health professional, and to your family, thank you. I know what a strain this has been, and we all recognize how you're keeping our communities going. As a government, we've launched incentive programs and paid public information campaigns. We've mobilized vaccine units deep into every corner of the community. We've stood up scholarship prizes for young people getting the vaccine. We're offering free testing. We've lowered every conceivable barrier to getting vaccines, and we're going to do even more in the coming days. But ultimately, this is in your hands. This is a diverse county with diverse views. This should not be about politics. And regardless of your values, regardless of your personal political beliefs, there is a reason to get vaccinated. If you believe in the U.S. health system, you should get vaccinated because you believe in the expertise of the world's foremost medical experts and the incredible achievement modern medicine has provided us. If you believe in personal responsibility, you should get vaccinated. Not because it's mandated by the government to do so, it's not. But because you have the choice and you know it's the right thing to do for yourself, for your family, but also for the community around you. If you're someone who's skeptical of government, you don't have to listen to me. Get vaccinated because you acknowledge the incredible role the private sector has played to produce and distribute a vaccine so quickly, and reward the entrepreneurship and the risk-taking that brought this cure, this miracle, to the market. If you're a Trump supporter, get the Trump vaccine, something he so proudly touted as part of Operation Warp Speed, something even Sean Hannity now advises you get. If you're a Biden supporter, maybe you've already gotten the vaccine, but take the extra step and reach out to a neighbor, reach out to a friend, reach out to a family member, a colleague who remains skeptical, and tell them where they can find a vaccine, and help explain to them how safe and effective and urgent it is. Beyond the obvious need for vaccines is the need for us to band together, and these things go hand in hand. Raising our threat level is something we never wanted to do again. We made it so far, and we've avoided the worst of this crisis by working together as a community. So let's work together. Let's provide another boost to the economy. Let's prevent things from becoming more and more of a problem. Let's provide a sense of hope to this community. I know history will look back at this time, as it has the previous 2 times our hospitals have come close to being overwhelmed. And history will judge us for how close we stood together to overcome this latest challenge. It's been exhausting, it's been long, but we have a solution. We have a vaccine, and we have our resilience as a community. Let's work together and get this done. Thank you. We'll hear from Mayor Turner. Then I'll repeat my remarks in Spanish, and everyone will answer questions. Mayor, thank you again.